Hello everyone, and today we are going to talk about a disease which is a very common disease. I'm sure most of you must have heard about it as well. It's called cervical spondylitis. But before we understand the very meaning of this complicated term, we need to understand certain terminologies related with your spine or your vertebral column. Okay? So, your vertebral column or your spine is made up of bones. These bones are called vertebrae. The singular is vertebra and the plural is vertebrae. And then there are these rubbery discs which are present in between these vertebrae. Now, these vertebrae and these rubbery discs are stacked on top of one another, forming the entire spinal canal or the vertebral column. The bundle of nerves, which is known as the spinal cord, runs down the length of this spinal canal. So the discs in your spine or the discs in your vertebral column function like shock absorbers between these vertebrae. Whenever you jump or you sprint or you take a jog or a run or you dance. So these rubbery discs act as shock absorbers and they help in protecting the entire vertebral column and eventually the spinal cord. So now we know that this video is about cervical spondylitis and we are going to talk a lot about the spine or the vertebral column. But we still need to get to the root of the exact meaning of the term cervical spondylitis. So what do these two words mean? You must have realized that this term is starting with the prefix spondy. The term spondylitis is starting with the prefix spondy. The term spondy refers to the vertebral column or the spinal column. So if you are diagnosed or if somebody you know is diagnosed with cervical spondylitis, one thing is for sure, that this condition has got something to do with his or her vertebral column or the spinal column. And now let's understand the meaning of the suffix of this term. The suffix of the term spondylitis. So spondy relates to the spine and then we have itis, I-T-I-S. So itis is a suffix used in pathological terms that denotes inflammation of any organ, for example bronchitis, gastritis or neuritis, and hence in extended senses nouns denoting abnormal states or conditions or excesses, tendencies or even obsessions, for example telephonitis, somebody who has an excessive urge to talk over the phone, or baseballitis, somebody who is obsessed with playing baseball. So basically, jokes apart, what I'm trying to say is that the suffix itis means inflammation. Another example is colitis, which is literally colon inflammation or figuratively inflammation of the colon. So the ending itis is one of the building blocks derived from either Greek or Latin, and it is used to construct various medical terms. So here we know that spondylitis, spondy plus itis, means the inflammation of the vertebral column or the spine. Now, it does not necessarily mean that the entire spine or the vertebral column is going to be inflamed. The vertebral column is divided into several segments, and any of these segments might get affected by inflammation. And now we come to the exact term, which is cervical spondylitis. So we are now specifically referring to the cervical region or the neck region of the spine. So cervical spondylitis eventually ends up meaning inflammation of the spine or the vertebral column, which is present in the neck region of the human body. Or in other words, you can say inflammation of the vertebral column present in the neck region, or the inflammation of the cervical region of the vertebral column or the spine of the human body. That is the exact medical meaning of the term cervical spondylitis. Now, some of you might get confused with cervical spondylosis, which is also another medical condition. So, let me just clarify between the two here. Cervical spondylosis is a general term for age-related wear and tear, which is affecting the spinal discs in your neck region or the cervical region of the vertebral column. As the discs get dehydrated and shrink with age, signs of osteoarthritis start to develop, including bony projections along the edges of the bones, which are also known as bony spurs. Cervical spondylosis is very common and it often worsens with age. You need to understand that it is a degenerative condition. It worsens with age. More than 85% of people who are older than the age of 60 are getting affected by cervical spondylosis. However, most of the people experience no symptoms from these problems at all. But when symptoms do appear, non-surgical interventions often are most effective. And that is where yoga, pranayama, mudra and bandh come into the picture. So now we know the difference very clearly between cervical spondylosis and cervical spondylitis. What is cervical spondylosis? It is a type of a degenerative disorder or a breakdown with age of the spine and the discs in your neck region. It is a general term for the situation which occurs in your neck area. So it is an arthritis of the joints or the spaces between the vertebrae present in your neck. On the other hand, cervical spondylitis is the inflammation of one or more vertebrae present in your neck region. Itis obviously means inflammation, as I told you in the earlier part of this video. So cervical spondylitis is the inflammation of one or more vertebrae occurring in your neck region. Now, whenever we talk about cervical spondylitis or cervical spondylosis, yoga is definitely very helpful and effective. And especially because of the COVID-19 situation, because of this lockdown, most of us are not able to step out of our homes and we are spending a lot of time at home. We are working from home. WFH is happening. And at the same time, we are now compelled to do a lot of household chores also. Something which we have not been used to, frankly speaking. So I can give you some very common examples in the house where a lot of forward bending is happening from your vertebral column. For example, putting the clothes into the washing machine, then bending downwards again and pulling the clothes out from the washing machine again, filling buckets of water, bending downwards again to lift those heavy buckets of water, or bending down to lift any heavy object. A lot of forward bending is happening, either from the mid-back, or it is also happening sometimes from the neck or the cervical region of the spine. Apart from these chores, a lot of us, because we are working from home, we have to spend a lot of time with our laptops, with our tablets, with our smartphones. So most of the time we are working either on the laptops or the phones and we don't even realize that we are actually hunching over. And what I mean by hunching over is that we are just bending over the laptop or bending over the smartphone screen. And when we hunch over, the region of the spine that gets affected the most badly is the cervical region or the neck region of your spine. Because when you are hunching over through the neck region or through the cervical region of the spine. So your neck is bending forward, your cervical region is bending forward, and you continuously work for long hours without even realizing that your posture is becoming bad. You're bending forward way too much through your neck region. And this bending forward through the cervical region over the period of time can start to create a lot of pain and discomfort in the neck region of your spine. So in this video, I'm going to show you 5 yoga poses which are very easy to do, can be performed by anybody at any age, and also considering the fact that cervical spondylosis and spondylitis usually affect the people who are higher in age. So as yoga instructors, we need to understand that we can't really challenge them with difficult over the top style of yoga practices. So these following poses are going to be very simple. Some of them can be performed at any time during the day, and some of them need to be performed obviously on an empty stomach, which I will of course keep guiding you with during the course of this video. But you should practice these yoga poses every day. In fact, these yoga poses should become a part of your everyday lifestyle, your daily routine. And you should practice these poses for a minimum time period of 90 days or 3 months, or carry on till 120 days or 4 months if you want to notice some concrete changes, any concrete, measurable, positive changes in the cervical region of your spine in terms of the pain and the discomfort that you might be feeling right now. So these are very simple yoga poses, and these poses can be performed both by the patients suffering from cervical spondylitis as well as those who are suffering from spondylosis. And these yoga asanas will make sure that they strengthen all the muscles which are also holding and supporting the vertebrae and the discs in the neck region or the cervical region of your body. So these asanas actually help to strengthen all these surrounding back muscles anatomically. All the muscles which are holding and supporting the vertebrae, keeping them in place together, specifically in the cervical region or the neck region of your spine. So all these yoga poses are very important for that, and these yoga poses will ensure that the muscles in the neck region of your body, all these muscles which are holding and supporting and keeping these vertebrae and the discs in between these vertebrae in place, are becoming stronger. These poses are going to ensure that these muscles are becoming stronger, and then when they become stronger, they are eventually in a better position to help you suffer less from any pain and any discomfort. Once these muscles become stronger, they are going to just lift away the pain which is bothering you in the neck region. So having said that, without any further ado, let's get started. So now, let us begin. Shall we start? Okay. So now, sit in any meditative pose, maybe in Vajrasana. And the first exercise, what we are going to do today, I'm sure everybody knows it. These are neck exercises. So first inhale, breathe in. Now while breathing out, twist your neck, turn to one side. You are not actually twisting your neck, you are just turning your head towards one side, staying there for some time. Come back again. Very nice. Do it on the other side. While breathing out, you are going out to the side, staying there for some time, and then coming back. You can see that I am doing it in a very relaxed way. There is no hurry, there is no speed. In speed, you will hurt yourself. So do it very gently, as much as you can turn. If you are not able to turn your neck, don't force your neck. Slowly with practice, you will become more flexible. Now the next practice is to look up towards the ceiling. Throw your head back as possible. Do it very gently and then gently come back. Here, you have to inhale when you go back. Breathe in as you go back. Now we will stay here for some time and do one more variation. And that is as if you are looking at the ceiling here and there. So you may turn your head to the right side. What's going on there? Is it clean or not? Come back, look towards the left side of the ceiling. You're just checking out the ceiling of your room. It's a very good neck exercise. Now come back to the center. Once more, let's do it. Throw your head back. It is a very simple exercise, but very gently you have to do it. Looking all over the ceiling, checking out the ceiling. Very fine. And now slowly come back and sit straight. Don't ever bend down. People suffering from cervical problems should never try to touch the chin to the chest. Look straight, look up, and that's how you should handle and manage your neck muscles. So this was the second exercise. Now the next exercise which I want to show you. Stretch out both the arms in front of you. Stretch them further, like this. Very good. Now expand yourself, open up yourself. Inhale, take your arms out to the side and open out your chest. See how nicely I am expanding my chest. My entire thoracic region is expanding. And the cervical region from behind is also getting contracted. And my arms are opening out to the side. Come back again while breathing out. Now change the angle. Take the arms slightly up. Inhale. Stretch yourself. Exhale and come back. Very fine. Now change the angle again. Take your arms further up. Inhale. Go back. Exhale and come back. Let's change the angle once again. Go back. Look up. Come back. And now rotate your arms from behind and come back. You will notice that the cervical region is getting massaged. All the muscles in the cervical region are getting massaged. And the muscles from the left and the right side are pressing against the spine. And the spinal cord is also getting aligned. And the entire vertebral column in the neck region is getting properly aligned. So this is something which the person can do standing also, sitting also on a chair, wherever you are. Even if you are in the office, you are in the office all the time. So whenever you have some free time, you can do these exercises while sitting on a chair also. Or you can do these exercises at your house because your house has also become an office these days. So whenever you have time, you can always just keep sitting on the chair, take out 5 minutes and do these exercises. Now let's do the next exercise, and for this exercise you may stand. First we will do the cone asana. So keep both the legs away, practically 2 to 2.5 feet away from each other. Both the feet are parallel. And now stay in this position. One arm on your shoulder, another on the side. Turn your neck. So this is your neck exercise in any way, and just go down. And as you go down, try to see that your chin touches your shoulder. So your neck is twisting and it is also going down. So automatically the strain of your neck gets released. Breathe in while going down, and while breathing out, come back to your original position. Slowly come back to your normal position, and the arms will go down. Now do the same exercise on the other side. Turn, hand on the waist, one sliding downwards, and the chin is slowly touching the other shoulder. So that's it. That's exactly the posture. So start doing that. Very well done. Slowly come back to your original standing position. Now usually I have noticed that when people do this sort of konasana, they tend to bend forward. And when they tend to bend forward, I'm going to show it to you. I'm going to show you the wrong way of doing it. See, this is how they are bending down, bending forward. So the exact alignment of the spine is not maintained here. There is no benefit at all. And so what you are supposed to do is, in the beginning, try to stand against a wall. Take the support of a wall behind you, so that you are exactly straight when you're going sideways. And then try to do this exercise systematically on both the sides as I have shown you. So this is another posture which is very good to strengthen the cervical muscles. Then we go ahead. We will do what is known as the trikonasana. So both the legs together, little comfortable, or they can be slightly away so that you don't lose your balance. And now while inhaling, raise your arms up to your shoulder level. While exhaling, bend forward but look up. Look up and bend forward. So here, the circulation is towards the upper area of the body, especially the neck region. And automatically the stress releases from the neck region. Looking down has to be avoided. Only in this position. It is known as the triangle pose because you can see the triangle shape being formed. Trikonasana. Now you can try to hold your big toes and stay there. Slowly, you can come back to your normal position. It's a great exercise. It also helps to enhance the flexibility of your legs, enhance the flexibility of your hamstrings. Overall, good circulation is happening in the entire body, especially a lot of good blood circulation is happening in the cervical region of your spine. So now let's sit and lie down. So basically lie down. Just lie down and relax. This I'm sure all the yoga practitioners are familiar with. Everybody knows about Bhujangasana. But right now we are not going to do Bhujangasana. So we are just going to roll over and lie down on our tummy instead. And from here we are going to do what is known as Sarpasana and not Bhujangasana. Just take a look. So your fingers are interlocked behind you. Pull your arms away from you. Pull your arms away. Your shoulders have to be pulled away from you. Pulled away and behind. And take your shoulders behind you as much as possible. And try to look up at the ceiling. This is a posture which is very good for the cervical region. Relax and come down, right? So this is Sarpasana. We will do one little variation. It would do much good than what you expect. So again, lift your head up while inhaling. Now take normal breathing, but now turn your head to look at your toes. Very good. Now you are deliberately trying to put pressure on the cervical region muscles of one specific side. Keep looking towards the toes on the left side. Now slowly come back and try to look at the toes over the other side. The shoulders are being pulled back. Very nice. On the other side now, you're looking. Perfect. Come back now and relax. Relax for some time. In case of cervical problems, if you can't turn your head on the side it is giving you strain, then just look straight. You should not try to tilt your head to one side. You can just rest your chin. You can just rest your chin on your hands like this. You can keep your chin on your hands like this and just relax. In case tilting is giving you some pressure, then you can just rest your chin on your hands. See, the point is, when there is pain, you're not supposed to do any asana, no movement, except rest. But rest for 2 to 3 days. Use a hot water bag on your neck. Definitely sit under the sun for 10 to 15 minutes every day. Allow your back and your neck to absorb the sun, the warmth of the sun. Every day, 10 to 15 minutes, it should be done. You should be sitting under the sun for 10 to 15 minutes every day and allow your neck muscles to become warm. It's a very good idea to have the warmth of the sun on your back, on your neck. So do this every day. But slowly, once the pain disappears, then you will be able to do these yoga asanas. Once you get relaxed, your pain will go away. The best way of relaxation would be to just lie down in Shavasana, lie down in Pranayama number 4 position. In this case, you will be able to relax your entire back and just practice Pranayama number 4 as you lie down on your back. At the same time, you can also use a hot water bag and you can keep it under your neck, or you can keep it under your upper back, and at the same time simultaneously allow the muscles in your neck and your upper back to become warm also. Whenever you are using pillows, you should use those soft fluffy ones, the ones which are available in the market these days, but make sure that the pillow is not just kept under your head. The pillow should be kept in such a position that it should be able to support your head, your neck, as well as your upper back, so that the entire region, this entire region of the head, the neck, and the shoulders and the upper back is getting properly supported by your pillow. So again, I am repeating that the pillow should be put in such a way that the shoulders are also getting supported. Then when the pillow is big and the shoulders are also getting the support, then the head is going to be in a neutral position. The neck is going to be in a neutral position. And when the neck is going to be in a neutral position, there is going to be less pain while you sleep. Pranayama number 4, diaphragmatic or deep abdominal breathing. The diaphragm is exercised in this pranayama. It is a muscular membranous partition separating the thoracic and the abdominal cavities of your body. Friends, if you struggle to sleep well, or if you know of anybody suffering from insomnia, sleepless nights, then this is the recommended pranayama. It is also very helpful for cervical spondylitis. Pranayama number 4 has a lot of benefits. The digestive organs stay very active. It reduces the fat which is collecting around the stomach region. One has improved breathing also. And at the same time, most importantly, it has a sedative effect on the nervous system. Thus, pranayama number 4 relaxes the entire body and the mind. It leads to quietude and inner harmony, lack of anxiety, lack of panic disorders and panic attacks. So you sleep better and you sleep well. So let's start. You may lie down on your back, keeping the knees folded towards the chest. Feet resting on the yoga mat and 1 foot apart from each other. You may now place your right hand onto your navel and the left hand, you can either relax it onto the side of the body, either palms facing up to the ceiling or down, as per your convenience. Or if you want, you can keep that hand on your chest. Now we inhale for 2 counts and exhale for 2. Remember, breath is never to be forced. If you observe little babies when they are sleeping, you will notice that their bellies rise up when they inhale and the bellies go down towards the spine when they exhale. This is how we breathe in pranayama number 4. Pranayama number 4 is the natural way of breathing in life. Just remember this much. Now, let us get into the experience of this process. As we inhale, we can feel our belly rising high. As we exhale, you should feel the sinking in of your belly. Inhale, belly rising up, and exhale, belly sinking in. If you notice this is the deep breathing exercise that I am talking about. One can practice 10 to 20 rounds of this pranayama before sleeping. Or one may practice this before shavasana. Pranayama 4 is a boon to many stressed minds. I would recommend, and I have also inculcated this pranayama during my relaxation sessions in my classes. It is a very, very important and a very effective exercise also for alleviating the pain in the cervical or the neck region of your spine. I shall now give you the counts. Let us begin pranayama number 4. Inhale, 1, 2. Exhale, 1, 2. Inhale, 1, 2. Exhale, 1, 2. Now slowly finish your last round and you may open your eyes whenever you are ready. Practice this for a week and do write back to me and voice your comments. So my dear friends, these are the simple exercises and yoga asanas which you can practice right in the safety and the comfort of your homes. These are very easy poses, very simple, can be done by anyone. At the same time, you also have to monitor the pain in your neck or the cervical region. If one day you wake up in the morning and you realize that there is pain in your neck region, then at least understand that there is either something wrong with the pillow that you are using or there is something wrong with the mattress that you are sleeping on. So please check the firmness and the flatness of your mattress. Please also make sure that your pillow is soft and fluffy and it is big enough to support not just the head region but also the neck, the shoulders and the upper back region, so that when you are sleeping on your spine, you can ensure that your neck and the cervical region of your spine is always held and supported in a neutral position. Once this is maintained, once this posture is achieved as you sleep, you can manage the pain in your neck very effectively. And with the regular practice of these simple exercises, these very simple yoga poses, the regular practice of these simple yoga asanas will ensure that slowly, the pain in your neck starts to diminish and eventually it will also vanish. So start practicing today. Namaste.